Hi, everyone. My name is Brittany Aramo, and I am in the Family Nurse Practitioner program here at Regis College. I am from Dracut, Massachusetts. I currently live here still, and this is where I grew up. I also have the luxury of also working in the town of Dracut as well. I work at the Diabetes and Endocrine Center, affiliated with Lowell General Hospital, and I have been working there for the past 7 years. I graduated from St. Anselm College in Manchester, New Hampshire back in 2010. When I originally had graduated, I worked at a skilled nursing facility, worked on the floor, and also worked as the evening and overnight supervisor when needed. I then started working at Lawrence General Hospital and I worked in med surg. I was there for about 2.5, 3 years, and also worked on their cardiac step down unit as well. I worked on a renal floor where we mostly did peritoneal and hemodialysis patients. Also had a lot of withdrawing patients, a lot of precaution patients as well, and infectious disease patients. We also did epilepsy studies and seizure patients as well. So it was a very great learning experience. And on our cardiac floors, it was not a critical care floor, but more of a step down unit. After that, I started working at Lowell General Hospital, where I did get into the critical care setting and I did start my training and classes for my CCRN. When that had started, I had the opportunity fall into my lap to work in my current role at the Diabetes and Endocrine Center, and I did take that outpatient position. I was able to earn my certified diabetes care and education specialist license, and I am nationally certified with that. And that has been my end goal, is to end in diabetes. I have been living with type 1 diabetes myself for the past 29 years. So that is what really had pushed me into the nursing world, but also to become a diabetes educator. And it has always been my goal to eventually get my nurse practitioner and hopefully specialize in diabetes. I have a lot of career goals, really hoping that I'll be able to work in my current office where I am now as a nurse practitioner specializing in diabetes and endocrine. That way I can bring more comprehensive care to my patients. I'm very lucky where I am. My providers are very gracious and really trust my judgment, and I get a lot of hands-on as far as the medication aspect for treating all different types of diabetes, type 1, type 2, and gestational diabetes, and everything in between that you can think of. I know I won't always have that luxury, so definitely taking the next step to getting my nurse practitioner is the next part of me being able to provide all my patients with the best care possible. I'm also hoping to start a bridge program with either our local community health center and also with our primary care locations scattered amongst the community. Diabetes is unfortunately a growing epidemic in the country, and there's a lot of things that we could do as providers, but also as people to help prevent prediabetes and type 2 diabetes. And hopefully, by working in more of a preventative practice manner, we can help to start stopping the spread of diabetes, or at least from taking place as early on in life as it's been happening. In my community alone, there are so many pediatric patients and children that are getting diagnosed with metabolic syndrome and type 2 diabetes. So definitely steps need to be done for sure to try to help prevent that from happening. I chose the family nurse practitioner track because I would like to be able to follow patients across their entire lifespan. Right now, I primarily work with adult patients and geriatric patients. We do see patients as young as 13 or 14 years old in the clinic. Um, but I would like to start working with children even earlier than that, again, because of the epidemic with prediabetes and type 2 diabetes in pediatric patients. And I also think it's really great to be able to stick with patients and really follow them throughout their entire lives through major milestones, life events, really establishing a connection with the patient and establishing trust and a great relationship can only help them on their journey to good health and preventing different diseases. As far as my family, I'm the oldest of three. I have a younger brother and a younger sister. My dad is first generation Italian here in the United States. So definitely have lots of good food and cooking at home. And my mom is also in healthcare. So I always kind of had that environment growing up. And again, with having type 1 diabetes, my parents were my biggest support system and really helped me grow and really helped me to stay healthy. They had to be very educated. Again, hopefully in my nurse practitioner track, working with children and also with their caretakers and parents to help them to stay healthy, that's something I'll be able to do. I'm really excited to meet all of you and to start this new course. My question for you, Professor, would be how open do you find that your patients are to trying different alternative and complementary therapies? It's definitely something I know a little bit about, but I am not well versed in, and I do try to incorporate that in my current practice with my patients. Sometimes I meet resistance with that, but I would love to know what your experience has been. Thank you.